L is for the way.
At petfix-club, we want to make owning a pet the best it can possibly be for you and the one you love. Enjoy personalised online pet care at petfix-club.com. Start your free trial today. Love your pet? Join the club.
Hi everybody and welcome to this week's IGTV video session. Good to see you all, and it's going to be an interesting one today, talking about veterinary physiotherapy, which is a relatively new concept. Anyway, my name is Pete Wedderburn. I'm also known as Pete the Vet, and I'm here as one of the co-founders of an exciting new website, PetFix. And the mission at PetFix is to provide good quality information to everybody, everywhere, all the time. As well as that, we have an online shop at petfixshop.ie, and in that shop you can buy good quality food and accessories for your pet. So just log on to petfixshop.ie to find out more about that. So today I'm going to ask our physiotherapist to join us.
Hi.
Thank you. Hi, Lynsey.
How are you?
Very good. And we haven't met in person, so it's nice to meet virtually. I've spoken to you by email.
Yes.
But listen, tell me all about yourself. We've got about 20 minutes to talk about stuff, and then we're going to take some questions from people. So We'll have to crack on with it. So tell me all about Lynsey Tanner. What's your story, Lynsey?
The story, gosh, it's a long one, really. I grew up on a farm in County Wexford, always been around animals, dogs, cats, cows, sheep, you name it, we had it. I think I was one of those kids, didn't always know exactly where I wanted to go, what I wanted to do, but I thought it was going to have something to do with animals. And I remember the day that I discovered the course for physiotherapy, and something clicked, and I just went,
You didn't go straight into that though, did you?
No, I didn't. No, so like I said, I didn't always know what I wanted to do. I was one of those 17-year-olds sitting a leaving cert, hadn't got a clue. I knew I loved kind of science and all that kind of end of things. So I went to UCD and I studied science, and I specialised in zoology. Loved every minute of it.
But that's like a fascinating topic. Anyway, I don't know if you know Susie Walsh, the dog behaviourist. She did her primary degree in zoology as well. I think it gives you a great grounding in animals generally, doesn't it?
It does, yeah. It's quite a broad subject, really. Saying that, like studying zoology, it's you could be very field based, or you could even be in the lab, even though it's still zoology. It's yeah, you could be doing anything really.
And but once you'd done your degree, then you found out about this master's, is that right?
Yes, I did, yeah. I remember I was like everyone in my final year in UCD, and I was going, what am I going to do when I finish college? Am I going to go on and do a PhD? Am I going to do a master's? Am I just going to try and find a job somewhere? What am I going to do? And I just remember, I think I was doing a deep dive on Google, basically. And I found Whittle University, which is in Essex over in England. And I saw the course for physiotherapy, and it was 3 years. And I thought, do I want to spend another 3 years studying? And and I thought, I hemmed and I thought for a little while, and I dragged my brother over for an open day to the college, and I fell in love with it. That was it. There was no turning back after that.
So how many people would there be in your year on the course?
I think we started with about 20 or so, and we finished with about 15. Some people deferred their year for one reason or another, but yeah, so it was a small enough class.
And are there many places you can study veterinary physiotherapy in the UK?
So I remember when I was doing mine, I was kind of limited with where I could actually apply to, because I had studied zoology. But that was deemed for that course, when they call it like a relevant science degree, that's what they call it. Whereas some of the courses would have only taken you if you were a veterinary nurse and things, which was a bit sad, because I remember going, oh, if I don't get this one, like, that's it. But luckily enough, I flew through the interview and all the rest of it, and I think they realised that I was a real animal lover, so that was good.
And can you train to do veterinary physiotherapy in Ireland at all?
No. There's no universities anyway that do it. I know there's a few kind of online courses and things, and technically you get a certificate or a diploma at the end of it, but it's not really the same. You know,
It's surely very, very hands-on. Hands-on, yeah. One of our veterinary nurses in Bray, it's her particular interest, and she's done extra studies in veterinary physiotherapy. I think it's kind of like a profession which, it's very different to the human physiotherapy profession, isn't it, at the moment?
Yes, very much so, yeah. And one of the main things about that is really that in human physiotherapy, if you have some issue with your arm or your leg or whatever, you just go and you see a physio. But for us, we need a referral from a vet like yourself to say, this is the problem with this dog, go ahead and treat it. Basically, so
it's very it's interesting that the treatment of animals is actually more tightly regulated than the treatment of humans. You know, anybody can set up as any kind of therapist and say, hello, I can treat you if you're a human, but only vets are allowed to treat animals. Absolutely, it's very strict about that, and that's because animals need that protection, because otherwise
they can't tell us where it hurts or if it hurts or how bad it hurts. So that's why, you know, we need specially trained people to be able to say and calculate on a scale they're very, very sore, or they're only a little bit sore, or, you know, so it's the right way to do it, really.
And tell me about your studies then, to go back to your course. You did a very interesting dissertation towards the end, I think, didn't you? Tell me about that.
I did. I looked at the biomechanical effects on the forelimb of different types of dog harnesses. And it was well, firstly, it was exhausting because the way it was going to be anyway was that I would do it from home, and that, you know, it was purely based on my research. But having never really done much research before, obviously I'd done a final year project for my undergrad, but that was very mollycoddled in comparison. So it was a big learning curve in research. And I did think, when I was looking at the results initially, that I was finding a real difference. So I was looking at, like, the harness that you held up there with the chest strap that goes in front of the shoulders.
Yes.
Yeah, so that one. I was looking at that one, and I was comparing it to the kind of Y-shaped harness that goes...
I think Julius Canine make a Y-shaped one as well. I think there's different ones that they have. So you were comparing... So basically, instead of this being in front of the dog's chest, this would be going to the side. Is that it? Going underneath.
So there's another strap that comes down the center of the chest and then up around the shoulders. So the theory being that the one that you're holding, my hypothesis was that would restrict shoulder movement. And really, in the end, after I did all my statistics and everything, it didn't. But I was able to, you know, through my discussion and everything, say exactly why it didn't and why we thought it would, or all the rest of it. So, but yeah, it was very interesting to be doing.
And were you able to publish it as a research publication somewhere? Apart from
I never really looked into it, to be honest, Pete.
No.
I didn't, but
maybe you will one day.
I kind of left it behind. It's been a PTSD for me at this point.
So on with the practical side of life, I guess. Yeah. So how long ago did you qualify then?
So the way the course works is, after 2 years, you qualify to practice with your postgraduate diploma, and then the third year, as I was saying, was the dissertation. So I got my master's degree in July last year. Okay. But I was qualified to practice the September before.
And so, where are you based, roughly speaking?
Wexford. So I'm based in Wexford, live in Wexford, but I can travel as an essential service to, you know, neighbouring counties if anyone has their dogs there, or horses.
It probably couldn't have been a more difficult time for you to start out.
I know, yeah. It was, but sure, look, you've got to paddle through anyway. Keep your head above water.
So I guess one of the main things you have to do when you start out is liaise with local vets, because you have to go work through them. And how has that been going for you?
because of lockdown, very difficult. So initially what I had done last year before lockdown and all the rest of it, I went to really just the ones in Wexford town, and I spoke to them, and one of them knows me very well, obviously, because my dad being a farmer. So I would know one of them very well, but the rest of them had never heard of me before, and I was going in like, oh hi, I'm just qualified, just wanted to let you know that I exist, and this is what I offer, and this is what I do, and maybe if you have any cases you'd like to send my way, that would be, you know, great, and all the rest of it. So it was slow to get going, but I'm slowly but surely definitely growing, and it's great. The progress is great, all things considering, with COVID.
And how would it generally work? Would you without COVID, would you normally be seeing the animals in the vet clinic, or would you be seeing them in your own home or in the people's home? How would it normally work outside of COVID?
So definitely outside of COVID, and even within COVID, I'm still seeing people at their own houses. So that wouldn't really change at all. But just before COVID hit, and obviously I was only starting the beginning of last year, I had arranged with a practice to be doing clinics 2 days a week with them. But because when COVID hit, then their practice is so physically small, owners, they stopped letting the owners in the building, and then it's just not feasible to do a physiotherapy session for me anyway when I want to demonstrate exercises, or, you know, talk to the owners about what I'm doing or what we plan to do, when you can only talk to them outside without actually showing them what you're doing. Because I could disappear off for 40 minutes and just sit there and pet the dog, you know. So it's nice to actually be able to be there with the owner doing the session for me.
And does it kind of work in the same type of way as human physiotherapists, which I'm more familiar with because I've had injuries and so on? And how that would generally work would be you'd have an initial kind of assessment session with the physio, and they would then tell you, they'd probably manipulate you a bit and put some funny machines on you and do that kind of stuff. And then they would send you away and say, do these exercises, but come back in a week, and then come back the next week. And you might have, I don't know, 6 sessions altogether or something. And then hopefully you're fixed. How does veterinary physiotherapy compare with that?
Very, very similarly. Probably one of the only differences is that with, like, as you say, you go to the physiotherapist and you can tell them, I have a pain in my arm, that's where it hurts. And they will work solely on the pain in your arm. Whereas if a dog comes to me and they've had surgery on their cruciate ligament, I'm not just going to look at the cruciate ligament, because depending on how long that's been ruptured for, or if it was a partial tear, or whatever the case may be, there are very likely going to be secondary compensations, likely in the forelimbs or in the back. So I'm going to look at them standing to see whether they're offloading any weight anywhere. I'm going to look at them moving, so I'll be able to see if they're tensing themselves when they're walking or trotting, or looking at their different postures and things. And then as well, I'm going to palpate the muscles all over the body. And if there's any back pain or anything, I'll be able to see the muscle spasms there, and things like that. So that's probably the big difference. And then, like you say, I'll do my treatment and manipulate, put some fun, exciting machines on them, and send them away with a few exercises, basically. But yeah. And
tell me what sort of cases you would see. I mean, I can probably guess some, but you tell me what would a typical caseload be for a veterinary physiotherapist? When can you help animals?
You can, well, physiotherapy for one is just as important in preventing injuries as it is to rehabilitate them. So a lot of the time you'll find that you might only think of it as a post-operative case, but it's just as important pre-operatively as well as it is post-operatively, because you're strengthening muscles. Say, you know much more about operations now than I would, but if you're cutting into the muscles, you're tearing them. But if that muscle is very, very strong to begin with, and you've been doing physiotherapy for a month before, it will take much less time to recover fully than it would if there was no strength there in the first place at all. But I'd say I get mostly a lot of arthritic cases, really, And I always say to people, the worst thing that you can do for a dog with arthritis, and I'm not even just coming up with this myself, I've read it in different studies, is to throw a ball for them, because and people hate to hear it because they're like, oh, but she loves running for the ball, she loves getting it, it's great, it's good exercise for her. And you're like, oh yeah, but so it's one of those things that dogs, if you throw anything for a dog, they're very likely going to run after it because it's fun and it is exciting. They do love it. But the problem is that it hurts their poor little legs and their knees and their joints. And it's the next day that they'll come out and they'll say, oh, little Nitsy there now is awfully stiff. And that's why, because you've exacerbated the inflammation in the joints that was already there from the arthritis. So, yeah. I see quite a bit of arthritis. I've had 1 or 2 neurological cases, and yeah, I think that's kind
and
of.
You is it mostly dogs that you treat?
Mostly dogs, but I do horses as well. Yeah, horses are really fun to work on.
What about cats?
Cats, I personally have yet to work on a cat, but I do know there are physios out there who have worked on cats, definitely.
And rabbits, I'm quite sure.
I'm sure, yes.
Yeah, I mean, animals' bodies are animals' bodies, aren't they?
Yeah, that's just it. Yeah.
I mean, I think one of the fascinating things about veterinary and is really how similar they are to us. If you look at, well, you know all this, but like all of the bones and the muscles and the tendons and the nerves,
they're all exactly the same.
Exact same names. They're exactly the same. They're just modified slightly for the animal's purpose. Yeah, which is quite remarkable, isn't it?
It is. It's fascinating. Yeah, like when you look at them and you go, oh, that's the same bone there, and like especially with horses, I find, because their cannon bone is your wrist, and you're there going, that's really peculiar. But yeah, it is. It's very interesting.
People often get confused with dogs and cats. They kind of think that the dog's here in front leg is a knee or something, and
yeah. Or they don't, or even where the hip is in the dog, maybe you mightn't think that there's a joint up there at all, but that the knee is the hip, and
so people do get confused. I think the interesting thing that people don't realize, and I think everybody should know this, everybody watching know this, dogs and cats walk on their tippy toes. So a dog, when we walk with our feet like this. So that's my foot, right? My heel is there, and that's my toes. Whereas dogs and cats are like this. So they walk on their tippy toes, and the equivalent of their heel is up in the air all the time. And it's a bit confusing when you first think about that, but it's pretty obvious, I guess.
Yes,
it is. Do you use video footage at all to analyze animals' movements?
Certainly in between sessions, I would. Sometimes I'll have clients send me a video and they'll say, oh, here's the video, do you think she's getting any better, or do you think she's actually maybe gone a little bit downhill? It's really handy, and I usually use WhatsApp for that. It's a great tool to be able to share videos, and it saves them saying, can you come and look at the dog again, and paying for another session and things. It's really, really handy.
Now, one of the things you did before this chat was you sent me a list of the treatments that you use, and I'd like to know something about those treatments. And I have to say, first thing I'm going to say is I'm aware of some of them, but I'm not aware of all of them. So these are really quite specialized.
They're quite specialized that I could use.
Yeah.
Sorry.
Really. Yeah, it's quite specialized. Then it's a veterinary physiotherapy thing more than a veterinary thing, if you know what I mean.
It is, yeah. And the other thing is as well, you can also be like an animal massage therapist, which is a very good basis for physiotherapy. But for all the different machines and things, it's a very specific training to go through to remember different settings and things, because some of them have an awful lot of settings on them that you need to remember and go, oh, what's that one for now? But and especially some of them have a lot of contraindications as well. So if that's again why referrals are very important, because if a dog has a skin condition, or if they're on NSAIDs, or if they've got ulcers or anything, if there's anything going on internally, I need to be aware of it so that I don't use the wrong machine and make it worse as well. So
And listen, I know that a lot of vets, unfortunately, are quite skeptical about some of this sort of some of these techniques and some of the equipment. And I'm sure you've come across that.
Yeah, plenty
Yeah.
of vets think, sure, look, we've been going on grand for the last 100 years without physios. Why do we start to need them now? But that's just it. You see, is that we've been going on fine, you know, but we could be going along much better.
Right.
So,
And so are they all evidence-based yolks, basically? Are they?
yes,
Like
they
they've done
are.
studies and they show that they absolutely, definitely improve
Yeah.
things. Because that's
Oh
what a lot
yeah,
of vets wonder about.
definitely.
Because the problem is, like, out there in the whole world of different therapies, there are some weird and wonderful things which are like black boxes that really don't do very much at all. And so,
Yeah.
unfortunately, I think some vets they might put some of the physiotherapy boxes into those
Yeah.
categories. But you
Yeah.
work with stuff that's been proven to work, right?
Yes, yeah.
Okay. So take me through some of them. Take me through the different techniques and machines that you use.
So as I was saying there about massage and stretching, they would be two of the most kind of basic manual therapies that you'd be using. And they're, in my opinion, nearly underrated because they've got so many benefits from them that you get to see in the dog, or horse, the animal, we'll just go with animal. When you're treating them, it's a real pleasure to be able to do it. And massage, has an awful lot of benefits. It restores function in your muscular junctions. It releases tension and strain in tissues, and you can, depending on what kind of technique you use, you can break down scar tissue and different adhesions in the muscles as well. Massage also releases endogenous opiates. It releases oxytocin, serotonin, and dopamine, which are all relaxing drugs. Well, I say drugs. If you were to take them externally, they all relax you. And they also reduce the levels of epinephrine, norepinephrine, and cortisol, which are all stress hormones in the body. By doing this, you're also creating a very pleasant experience for your dog. So it means that they get the feeling, so they know when the physiotherapist arrives, oh, I'm going to feel great after this. I'm happy, I'm relaxed, I'm not panicked. That's one thing about doing clinics in a veterinary practice, is that a lot of dogs get anxious when they're going to the vets, because a lot of the time they're getting injections, or they're getting their temperature taken, or other things that aren't quite as pleasant as physiotherapy. So that's why I do actually really enjoy carrying out my sessions in people's homes, because they're already relaxed, they're at home, and all you're doing is coming in and making them even more relaxed.
And do you teach owners how to do the massage themselves once you're gone?
If I think it's necessary, I will, yeah, but it would only be a very basic level of massage. I wouldn't teach them anything that could ever do any harm to the animal. It's kind of foolproof stuff, essentially, but very, very beneficial, and can also create a really good bond between me and the pets, and their owners and the pets as well. So it's really good. And then with stretching, essentially does everything that massage does, but you're also increasing range of motion in joints. So for any dogs that maybe haven't been using their joints for any reason that's causing them pain, if they're just bracing and they're not using that full range of motion, then they've lost that. So it's really good for being able to regain some range of motion.
Very good. And then I've got a name here called photobiomodulation, and I have to confess that's a new one to me. Tell me about photobiomodulation.
Photobiomodulation is basically an umbrella term for anything in the category of light therapy. So it could be blue light therapy, red light, or laser therapy. And essentially all that does is, I say all that it does, very simply, it feeds the cells in the muscle tissues with energy. So it feeds photons into the muscles, and then the mitochondria in the cells absorb it, and they transfer it into biochemical energy, and that stimulates tissue repair mechanisms by upregulating the metabolism in the cells themselves. So it's quite technical, but when you think about it in simple terms, it provides energy to reduce the length of healing time that it takes, basically.
That's very logical.
Yeah, it is. And then as well as that, on one end of the table it stimulates, but on the other end it can also inhibit pain as well. So you can increase the dose to a point where it becomes an inhibitory effect on the nerves themselves, which is really interesting.
And then I've got another couple of things here. TENS and NMES. TENS and NMES. What are those things?
So TENS stands for transcutaneous electrical nerve stimulation, which are lots of long words, and NMES is neuromuscular electrical stimulation. They work very similarly in that they both emit an electrical signal into the tissue, but TENS works to provide pain relief. It stimulates sensory nerves, which actually stimulate the opioid mechanism in animals. So it releases enkephalin, which is an endogenous opiate in our bodies as well as dogs or horses' bodies. And that actually reduces the activation of noxious sensory pathways. So by doing that, it provides pain relief. Whereas the NMES machine actually artificially activates the muscle fibers, so it causes the contraction of the muscle. So that's not used for pain relief at all. It's more used in kind of neurological cases to try and maintain as much muscle mass as possible during the rehabilitation. So you would use that.
I had that one. When I was like a kid, like 14 years old, I had a problem called tenosynovitis, which was basically sore feet after running. And I had to put my feet in little water baths, and I got electric shocks through this machine. And my feet kind of twitched. Now that's probably an ancient, well, it's a long time ago now. It's like 40 years ago. I'm quite sure it's much more refined these days.
It is, yeah. The machine is probably only about that size, and it's got a couple of little pads and with gel on them, and you just pop them onto the muscle, and away you go.
Okay. And tell me, I've got a couple more here. Pulsed electromagnetic field therapy and thermotherapy. Tell me about those.
Thermotherapy is probably simpler, so I'll start with that one. So that's either hot or cold therapy. Both are really, really good for providing pain relief, because actually the sensory pathways that make you feel the hot or the cold are quicker to the spinal cord than the pain signals going to the brain. Exactly, the pain nerves. So it actually means that you feel the heat instead of feeling the pain. So that's one thing. That's called the pain gate mechanism, and that it shuts off one because it's quicker. And then the other thing is that you're also so with heat, it causes vasodilation. That's what I was looking for. So you're increasing the blood flow to and from the tissue. So you're bringing in oxygenated, nutrient-rich blood, and you're flushing out any toxins and things from whether it's damage that's there. So that in itself speeds up the healing mechanism. And then the cryotherapy, being the cold end, you're causing vasoconstriction, so you're reducing the blood flow, and you're also reducing the secondary tissue damage, which can be caused from inflammation, because when there's inflammation in the tissue, it causes, like you were saying, waste products and other toxins. So that can damage the tissue. So by cooling it down, it reduces the effects of that.
Very good. And tell me, what was the other thing? It was pulsed electrical magnetic field therapy. Tell me about that.
Yes, or for short, I just like to call it my pulse mag machine. It is, in my opinion, the all singing, all dancing machine. It does a bit of everything. If you've got a broken bone, there's settings that will attract osteoblasts to the area to promote bone healing. If you've got a sore dog with either acute or chronic pain, there's another setting that will essentially lower the action potential of the nerves so that the signals don't fire at all. So it doesn't, what it actually does is it optimizes the body's natural response to pain and healing, so that it functions on a better level. Basically, it's really really cool. I love that machine.
You love that one. You love that one.
Yeah, that one's my favorite.
And tell me, do you ever do? I know human physiotherapists do dry needling, which is kind of like, I suppose, a form of acupuncture, isn't it? Do you use that at all?
I don't. No,
You don't?
no. I never did any of that, and I wouldn't start to have any idea as to where to begin, to be honest, with any of that dry needling. No, never did it.
Maybe another course in the future, maybe.
Yes, well, a course I'm definitely going to do in the future is my hydrotherapy course. That's something I can't wait to get on and do now when COVID goes away a bit more. Yeah.
Listen, we got some questions come in, Lynsey. Can I just? What I'm going to do is, I'm going to bring them up on the screen here, okay? And somebody wants to know, can you tell us your favourite physio recovery story? Tell us a real life story that's happened.
My favourite? Oh gosh, I wasn't prepared for this one.
I know it's difficult.
That's a really, really difficult one, because a lot of mine are ongoing at the minute as well. So,
tell you what, what I'd like you to do is send me an email about your favourite one, and I'll put it up on my Facebook page, and we'll share it that way. Okay.
Yeah.
And somebody says, can you get a dog with mild arthritis back to chasing a ball after physio treatment? In other words, this dog loves chasing balls.
As I was saying before, I would never recommend to let a dog with arthritis chase a ball, but yes,
they love it. They absolutely love it.
You can get them back to normal function to a certain extent. It depends on the level of the arthritis and how much pain it's causing them. But definitely with remedial exercises every day and strengthening exercises, you can get them pretty much back to their good old selves. And pain relief is always the initial goal with going into any rehabilitation. It's always pain relief. So yeah.
And do you prescribe pain relief, or do you always go through vets with
that? No, I certainly never provide any pain relief or prescribe. I'm not qualified to do it, but if there is a dog that I've been treating, so as I was saying, a lot of the machines that I use do provide pain relief, and some of them work best when they're used, every day for a few weeks kind of thing. So a lot of the time I can actually rent them out to owners, or the little TENS machines are only about £30 on Amazon. I can just tell them, go buy one of those, and that'll sort you out for a while. But if there is ongoing pain there that really, really won't go away, I'll send them back to the vet.
Yes. Somebody called Peg has asked a question. I think this is a funny one. Are owners better at doing physio exercises for their pets than they are for themselves?
Yes, definitely.
Are they?
I have some very dedicated owners. There's nothing worse than seeing your pet in pain, and it's one thing, we're all guilty of it ourselves. You could have a sore back, even going to the doctor, we'll all question, I don't need to go and spend that money, or I don't need to, I'll be all right, I'm only, worrying about nothing. But when it's your dog and you can't, there's nothing worse than feeling helpless when you can't, help your dog out of any pain or whatever. So yeah, I have some very dedicated owners.
And somebody else has asked about fees for veterinary physios. How does that work? How do fees work for veterinary physios?
So I charge per session. I always like to let people know that you should never go into physio expecting everything to be sorted in one session. Typically, I would say, like you were saying earlier with human physios, about 4 to 6 sessions, depending on the condition. And for owners as well, I can spread that out over, 6 months or a year or whatever it is. But just as long as they know that nothing can be fixed in one session. And then, so I have a base rate, and then depending on how far I would have to travel, then charge a little bit extra for the travel.
And does pet insurance cover it?
You would have to check with the insurance company.
Mm-hmm.
I, to date, haven't had a client that had pet insurance. But I know
It certainly should do. It should do.
Yeah, it depends.
Absolutely.
I think it depends on the company. I've never had to deal with an insurance company yet. Because it's one of those things. I remember, because I studied in the UK, an awful lot of owners in the UK have got pet insurance, so I know from that a lot of those insurance companies do. But as I say, I've never dealt with one yet.
I think in general it's to do with what it actually says in the policy. It's really simple. Like, if people out there have got pet insurance, what you do is you read your pet insurance policy, and it'll say what's included and what isn't included. And veterinary physiotherapy may or may not be, I guess. It depends on
exactly
on them. Well, listen, Lynsey, it's been really, really interesting talking to you.
Yeah.
And I've learned an awful lot, and I'm sure folk out there have as well.
Good,
I think it's very exciting for you, because you really are. Like, there have been people doing veterinary physiotherapy in Ireland for quite a long time, but it's not been. I suppose it's not become part of the system, really, has it, up till now? Not
yet. But I would really, really hope that it will. Do you know that? Because there isn't a better feeling, in my opinion, than when, I go to a client and they say, oh, she took to you so quickly. Normally she's a bit standoffish with people going to her back legs or whatever. And you just think, well, gosh, I am trained to do it. And there's a reason why I am trained to do it, because it's a great job. And when people actually see the improvements in their animals, and especially I had a horse there a few weeks ago who just had a bit of a sore back, really. But at one point it was so sore they were fitting a saddle on her, and the horse buckled down to the ground.
Wow.
So I had 3 sessions with the horse, pony I should say, really. And even the daughter who rides it, I think she's only about 13 or 14. She said that she felt that the pony was going better underneath her, and even for a 14-year-old to be able to say, she felt so much more comfortable, it was even nice, because sometimes people go off and that's it, you won't hear from them again. But it's really good to be able to get feedback as well.
Yes, really rewarding. And tell me, is there a veterinary physiotherapy organisation in this country?
No.
There isn't yet.
There isn't. No, my governing body is actually the National Association of Veterinary Physiotherapists in the UK. And there are members in that organisation from all over the world as well. There are a couple of international associations for animal therapists as well. But in Ireland, there's certainly none that I know of anyway.
But that will absolutely change. Like, when I came to Ireland, which is 30 years ago now, there wasn't a companion animal veterinary organisation even. So companion animal vets like myself were members of the British organisation, because that was the nearest organisation we could join. But that changed. We now have the Veterinary Ireland Companion Animal Association Society, and and vets have joined that. And I think as a profession gets bigger in a country and gets more recognised, it does need to have its own, if you like, group of people working together and sharing and learning and all that stuff.
Yeah. Well, we've got our own WhatsApp group at the minute, so there's about, I think, 12 or 15 physios from Ireland working in Ireland in that, and we're all dotted around the country, but that's all we've got so far. Just a WhatsApp group.
It's very exciting, and it's a great time for you, and the best of luck with your career, Lynsey.
Thank you very much, Pete. Yeah.
We're going to sign off now. I'm going to just say again to everybody, thanks for tuning in, and so that's it. Well, we'll be back again next week with some other interesting person. I hope you all have enjoyed Lynsey, and I'm sure you have. And Lynsey, thank you so much for giving us your time.
No problem at all, Pete. Thank you very much for having me.
Thanks a lot, and the best of luck with all that you do from now on. All right.
Thank you very much.
Thank you. Talk to you again.
Bye. Talk to you again.
L is for the way.
At PetFix Club, we want to make owning a pet the best it can possibly be for you and the one you love. Enjoy personalised online pet care at petfix-club.com. Start your free trial today. Love your pet? Join the club.